Hello, Dr. Young, firefighter Stephen Glovac with Danville City Fire Department. I am here today with Lieutenant David Spanyer. He is a firefighter paramedic here. And this will be video one, talking about attributes of a good EMS leader. And thank you for joining me today.
Thanks for having me.
Yeah. So, plain and simple, what are some things that you feel are good attributes for a strong EMS leader?
I feel like I've seen both good and bad EMS leaders throughout my career in fire department and EMS, emergency services. I think definitely some good attributes is good leadership, time management, the willingness to listen to their crews, take care of the needs. I think the leadership in either the fire or EMS is kind of make sure you put your crew and your guys before yourself, even if you're the last one to go to bed, last one to do the chores. Kind of take care of the guys because they definitely take care of you.
Awesome. How are your feelings when it comes to appearance?
I definitely think that, and the guys would agree, we actually talked about this earlier today, of your appearance. It's kind of a twofold thing. Your appearance, it doesn't necessarily make or break you, but it definitely makes you, your professionalism and the trustworthiness and gaining that confidence and kind of that rapport with your patient or your customer.
Right. It's kind of funny that we talk about appearance and we're both in
T-shirts,
raggedy
right.
T-shirts. Been working all day.
It's been a long day.
It has.
But I think at the end of the day, your actions sometimes can overcome your appearance. But I definitely think you should not walk into a scene shirt untucked,
right?
Just looking a complete wreck, boots unzipped or untied or whatever.
Absolutely. Yeah. What about training? Not so much just like obviously training is important, but more like the do you feel like it's important that we try to keep up with the advancements in training that keeps coming out?
Absolutely. I mean, take today's day and age compared to when I started in 2007. Just what the changes, what I've seen in a short amount of time, and then you look back in fire or EMS. In the inception of the paramedicine program, around the 70s, and compared to just what we're doing now. But
right.
I think if you don't stay progressive, that you're absolutely doing a disservice to your customers, which are your patients.
Absolutely, I agree. And one last thing I'd like to ask is, how do you feel you in EMS as a paramedic, working in the fire service as a paramedic, how do you feel like the attributes of being a paramedic at a firehouse differs from at a EMS agency?
I think it's not more of the patient care's the same. We arrive, we do the same thing, airway, breathing, circulation, establish a good rapport with our patient, make a good assessment. I think more of the fire department setting for us that does not do a transport, we just kind of the first response then transfer the care over to EMS. It's more of that long-term, what happens during the transport sometimes of a longer transport or a county run or a inter-facility transport to another town, of kind of the either get to the hospital and you kind of get the establishment of further care from a nursing facility, the ER, or just kind of the grade of a patient over a long amount of time versus a short, very short contact with a patient in the our fire department setting of no transport.
Awesome. Well, I think that'll just about do it. Yeah, thank you very much.
Have a good day.